My name is Calliope, and I'm going to be performing your head-to-toe assessment today. Let's just check real quick and make sure that we got your vitals here. It looks like we had oxygen saturation, height and weight, heart rate. Okay, so we have gotten everything on the vital signs side. Excellent. And was there any particular reason why you wanted to have this head-to-toe assessment today? Very good. And any current pain or discomfort that you'd like me to know about? Very good. A head-to-toe assessment is going to start, of course, at the head and generally ends at the lower extremities, but we are going to be doing some neurological tests at the end as well. So I would like to start by palpating your head, looking at your scalp, your hairline, and for that I will need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. I'm going to get right into it. And I'm also going to look at your hair as well. Let's just take a look here. Good. So, do you have any particular concerns about your head or your hair? Any recent injuries? Any little knocks to the head? Or any issues with, say, the oil production of your hair? Or any recent hair loss? No? Okay. Taking a little look here. And I'm going to press in on certain areas. I'd like you to tell me if there's any pain or tenderness. Right there. Any pain here? What about right here? Good. Here. That looks good. Here. Refer to the sphenoid. We have the parietal on top here. Back to the head. And as far as the hair goes, so I'm just going to guard my fingers through the hair a bit. And then look at little bits, little strands. I'm looking for hair loss and hair strength. So if I run my fingers through the hair and more than about 10 hairs come back with it, then that's something we have to look into for possible hair loss. As I'm running my fingers through your hair, it's not really coming off. I mean, hair too, which is good. Not a lot of shedding. Right? So I'm just going to take a bit of hair here and I'm going to wrap it around my finger and just do a bit of strength testing. So take some hair, wrap it around, and do that. And just see what the general strength of the hair is, if it's appropriate for your hair type. Let's grab another hair. My finger and tug. Good. This side. Okay. Good. So hair strength looks good. Alright, so let's take a little peek at your face here. So I'm just going to look around here. Let me know if any of this is painful or tender. And we're looking at the skin of the forehead. Look at the cheeks and behind the ears there. Looking for rashes and skin abnormalities like lesions. Looking at the general color of your skin, whether there are patches of erythema or if there is pallor. Looking at the color of your lips here. And looking at your eyes, at the lacrimal glands, the conjunctival tissue here. So I'm going to pull down the eyelids. I'd like you to look up for me. I'm just going to pull down and look up. Good. Okay. And I'm going to pull up. I'd like you to look down. Pulling up. Good. Conjunctival tissue looks good. And the sclera, the iris, the pupil, eyelashes, the eyebrows, making sure everything looks within normal limits. Good. Good. And I'm just going to press around. Let me know if this is painful. Press there. Good. How about here? And here. Okay, what about right here? Good. And the skin temperature is normal. The skin is dry, but not overly so. That looks good, so you'll give me just a moment. We have a few things to record here. We're going to jump to the eyes. I'm going to get my little light here. Takes a moment to warm up. Right here. And we will look at your pupillary response. So I'm just going to have you look at my nose here. Good. And if I could have you just keep looking at my nose while I bring the light in very close to your eyes. There we go. And we want the pupils to be equal, round, reactive to the light. Perrrl. Good. Just keep looking right here. Bring that in real close. And how's the light sensitivity there? Not too bad. Good. Good, good. Just good. Okay. let's test your ability to move your eyes. So I'm going to have you look at my finger right here. Right? Just look at my finger and follow my finger using only your eyes without moving your head. Right? Go right over here. Just do your best. Follow my finger here. Good. We're just going to do these slow, smooth movements. Right? And how about up and down, up and down. Good. You feeling any sort of strain? Does it feel like your eyes are making any extra movements? Okay. Does it feel like they're twitchy at all? Is there any difficulty with doing this? No. Okay. Good. Just keep following my finger here. Good. Keep going. We'll just go up, down, up, down. Good. Here. Nice and slow. Diagonally down, diagonally up, and diagonally down, diagonally up. Good. How about all the way out, all the way in, all the way out, and all the way in, all the way in, all the way out. All the way out. Good. Accommodation looks great. Well, let's just record down. You had an eye exam recently? Okay. And were there any issues with your vision at all? Okay, good. And have you noticed since then, have there been any issues? Facial nerve. This is cranial nerve number 7. And I'm going to have you do some expressions for me. So if I could have you puff out your cheeks. Just like that. Good. Can you smile real big for me? Good. And can you close your eyes real tight? And can you raise your eyebrows? Make them bounce a bit. One of my favorite things to do is to talk to people while my eyebrows are moving at the same time. It puts them a little bit off, but in a good way. It's very funny for everybody involved. So, we are going to move to the neck for a moment. We're going to test your accessory nerve real quick. So I'm just going to have you shrug your shoulders a couple of times here. Just like that. Good. And did that feel weak at all? Did it feel hard to do? Okay. And I am going to take a look at the neck. With moving your head and neck at all? No? Good. Any issues with swallowing? Okay. So, trachea's midline here. I'm going to feel the anterior cervical, posterior cervical, deep cervical chain of lymph nodes here. Those feel good. I'm just going to come up here. Submental and submandibular underneath the jaw. Very good. And I'm going to have you take a dry swallow for me so I can look at the thyroid. So I could have you just do your best. It's not super easy. No, just take a dry swallow. There we go. Good. Good. Alright, we're going to do a little bit of range of movement testing. So I'm going to have you move your head side to side, up and down, and tilt to each side. So I'm just going to help stabilize you here. And let's start with going just to one side. Good. And the other. One side. And the other. Good. And let's go up, down, up, down. Okay, and we're going to tilt to one side. Good, and the other. Tilt to one side. And the other. Good, and then we'll put you right back there. Good. And were there any issues with that? Any strain? Any pain? Any restriction? No. Very good. Okay. Got most of your neck turned out, but we will be coming back to that for just a second in a bit. And we're going to come back to the nose right here. So I'm going to take a little peek here and do a little bit of palpation. Okay. Good. And let's grab the otoscope here. And this also likes to be a bit persuaded. There we go. Just a little bit right there. I'm going to have you tip your head back, and I'd like to look inside your nose, please. Wonderful, thank you. Now we'll look at one side. This isn't going to go in your nose. It just allows me to see the inside, looking at the septum, the nasal passage. Might be able to see the turbinates a little. We're also looking for polyps and irritation, deviation of the septum, perforation. Okay. Good. Good. And I'm going to grab something that I'd like you to smell. We're going to test cranial nerve number 1. So I'm just going to grab this. Here we go. And if you could just take a deep breath in here. Good. And what does that smell like? Ah, chloroform. Wonderful. I kid. Yes, it is alcohol. Good. Isopropyl alcohol. So, did that come in quite clearly? Good. Have you noticed any other problems with your sense of smell? No. Okay, nothing at all. Good. Let's go ahead and come to your sinuses then. So we have the ethmoid sinuses here, the maxillary, and the frontal in here. So I'm going to press down on these. Let me know if this is painful or tender at all. Good. And I am just going to tap along these areas. You can just tell me if this is painful or tender at all. Any pain or tenderness here? Very good. Very good. So let's go ahead and move on to the mouth and the throat. I am going to have you open the mouth for me. We're going to take a little look at the tissues, the oral cavity in general, the teeth, and then we'll look at the throat as well. Good. And when is the last time that you saw a dentist? Good, okay. I know that many people have a fear of the dentist, and that is quite valid. I remember what the dentist was like when I was a kid, and it wasn't a very nice process at all. And the people could be a little less than pleasant, but it's also one of the more painful places in the body. So luckily nowadays there are so many people that pride themselves and advertise themselves on being patient and kind and explaining quite a bit about what's going on. So it's much better than it used to be, thankfully. Much less painful too. I remember the last time I got a procedure, they used to just do the Novocaine, but now they give you a numbing gel and then the Novocaine, so there's no pain period. Very nice. If I could have you just lift your tongue to the roof of your mouth. Good. Good color there. Okay, and if I could have you stick out your tongue and say ah for me. Good. We'll just look at the back of the throat for a moment. Okay. Go ahead and close your mouth. Vagus and glossopharyngeal nerves are good. Okay. And then let's move down and we'll get into the chest here. I am going to take a little listen to your lungs and then your heart. So I am going to have you breathe as I tell you to. We'll take a deep breath in and out. It's up to you whether you want to do this out of your nose or your mouth. It doesn't matter either way. So I'm going to place the stethoscope, have you take a deep breath in and out. Deep breath in and out. Deep breath in and out. Deep breath in Deep breath in and out. Deep breath in and out. Let's go ahead and hit the lateral chest wall. I'm going to have you lift up your elbows so I can get to the side. We'll start right here. Deep breath in. Deep breath in. And out. Deep breath in and out. And if you'll give me a moment, I'm gonna come around to the back so we can listen to the posterior chest wall. Give me just a second. Deep breath in and out. 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 Last one, deep breath in and out. Good. Now we're going to take a little listen to your heart. So we are going to start with the aortic area. Just breathe normally here. Pulmonary. Tricuspid. And mitral. Let's get the apex beat as well. So this is going to be the mid-clavicular line, and we'll do the 5th intercostal space. We'll meet the two together. So we have right here. And then here we have 1, 2, and then right here. I'll just listen for a few moments. Good. Good. Sounds good. So let's take a little listen to the abdomen. And you don't need to breathe any special way here. I'm just going to listen around. Very good. Take this out for a moment and let's do a little bit of recording. Where are we at here? Good. We'll finish up with the abdomen here, so I am going to be doing some palpation here, and it's going to be a firm palpation, and it might be a little uncomfortable, but let me know if it's painful or tender. Okay, how is this? Not too bad. Okay. I know it feels a little bit invasive, but that's all good there. And now we're going to finish with some percussion on the abdomen, which means that I am going to be tapping along the abdomen. So, again, breathe normally here. Just going to tap around. Good. Before we get into the extremities, we are going to be palpating quite a few pulses. We're going to start with the temporal pulse at the forehead. So I'm going to feel one side here. Right. And that they are essentially synchronized. Good. And we'll do the brachial pulse here, right in the crook of the elbow. On one side. The other side. Both sides. And the radial pulse right in here on the radial side of the arm, right about the wrist crease here. I like to take 2 fingers here. Some people prefer 3. One side, the other. Both sides. Looking for any radial delay there. Good. And this might be a touch uncomfortable, but it will be quite quick. I'm going to feel the femoral pulse here. Oh, it's a little touch intimate. Not as much as the inguinal. Okay, one side. Good. Popliteal. It's a little complex to get to. This is behind the knee. And we're not going to be able to both sides it because you need both hands to get in there. Sometimes you can't feel this one either. Okay, and the other side. Palpating the popliteal. Lots of P's in that one. Palpating the popliteal pulse. Good. Post-tib, we're going to be able to do one side, the other, and simultaneous. Good, as well as dorsalis pedis. And then we'll come back to limbs at large. Good. Let's take a peek at the nails. So I'm going to be pressing on the finger on the nail. You can see here that it should blanch. See it right in here. And when I remove my fingers, the color should return quite quickly. And that's a good gauge of I'm going to press on your fingers here. I'm going to make sure the capillary refill is less than a couple seconds here. And yours is pretty much instantaneous, which is good. I like to see that. Now, let's look at the skin. Any problems with the skin or your joints? Sensation, pins and needles kind of feeling? No? Okay, let's go ahead and check your sensation. Now, I have a Wartenberg pinwheel here, and I'm just going to have you tell me whether you feel the sharp or the blunt. Right? So, this is what the sharp feels like. This is what the blunt feels like. Right? Oh, just tell me whether you feel sharp or blunt. Sharp. Sharp. Sharp, good. Blunt. Blunt, good. Blunt. Blunt. Sharp. Sharp. Okay, good. Very good. So we're going to do a little bit of range of movement and strength testing here. So I am going to have you bring your arms all the way back behind you. Okay, and bring them all the way in front above your head. Okay, and bring them up the sides above your head so the backs of your hands touch. Good. You roll your shoulders back and forward. Good. And can you bend at the elbows here? Good. And can you bend at the wrists? Good. Turn them in and out. And rotate them one side then the other. Good. Can you keep your elbows next to your side and move them in towards your body and out away from your body? Good. Can you put your arms up like this so that your forearms are parallel to your body? Okay, I'm going to try to push you. I'd like you to resist me. Good. I'm going to try to pull you. I'd like you to resist me. Good. I can have you stick your thumbs up. I'm going to try to bring it down. I want you to resist me. Good. Good. Okay. And let's go ahead and take a look at your legs. So I'm going to do a little inspection before checking the capillary refill. Right. We're just going to squeeze the toes here. So the legs didn't have any hot spots. The joints were cool to the touch. The skin was dry and smooth. Okay? And I am going to have you just move your feet up and down, and inside and out. Rotate them in and out. Good. Can you kick your legs out? Bring them back in. Very good. Can you lift one thigh up, back down, and the other thigh up, back down? Good. I'm going to press down on your feet. I want you to push up against me. I'm going to press down. You press up. Okay, now I'm going to pull up. And I'd like you to press down. Good. I'm going to put my hands in front of your legs. And I want you to try to kick them out against me. Good. I'm going to put my hands on top of your knees. And I want you to raise your legs against me. There we go. Good. Good strength. Good range of movement. And let me just do the pinwheel test. So, this is going to be sharp. And this is going to be blunt. Right? Oh, sharp or blunt? Sharp. Blunt. Blunt. Sharp. 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 Blunt. Blunt. Good. Now, lastly, let's do some neurological tests. I'm going to bring out the reflex hammer. We're going to start with the ankle. We're going to move to the knee. We're going to do the triceps and the biceps. So, I'm just going to hold your foot here, and I'm going to tap on the back of your foot. Just going to do just like that. Other foot. Good. And knee. So if you could let your legs hang freely. Good. Good. And if you could let one arm rest on your thigh so that I can get the back of your arm, and you can let your arm relax, let your leg take its weight rather. So we'll do one here, the triceps. Good. Then I'm going to hold your elbow here, and I'm going to tap on the crook of your elbow with my thumb in the middle there. Okay. Other side. Let your arm just rest on your leg. Let it take the weight of your arm. We're going to come back here and good. I'm going to hold the arm and tap on my thumb in the crook of your elbow. Just like that. Lastly, we are going to do a balance test and a gait test. So I'm going to have you stand up for me. I'm going to make sure you don't fall. I'm going to cage in here. I'm going to have you close your eyes and just try to stand still. Does it feel like you're losing your balance at all? Or can you hold that pretty easily. Good. Okay. Now you can open your eyes. I'm going to have you walk to the end of the room, just normally. I'm going to look at your gait, and if you could come back walking on your toes. Good. And if you could go back walking on your heels. Yep. Good. And if you could come back walking heel to toe. One foot right in front of the other. Good. Any difficulty with that? No, it's pretty easy. Very good. Go ahead and sit down. Do you have any questions for me at all? No? Alright, so you have a clean exam here. It wasn't anything out of the ordinary. Cranial nerves are intact. Neurologically, you're great. Your heart and lungs sound great. Your eyes are working just fine. Everything looks great. So, clean bill of health. Just going to make sure got everything. I did miss one thing. Earlier, I had said that we were going to come back to the neck, but I skipped right over it. So I'm going to real quick just palpate the carotid artery. So we're going to do one side. Feel the strength, the rhythm. The other side. Good. And it's a little too uncomfortable to do both sides at the same time, so we're not going to do that. But we are going to mark that we did do that. We went straight from temporal to brachial, didn't we? And that's why we make sure that we did everything on our checklist here. So I'm going to sign off. And that will conclude our head-to-toe assessment. I'd like to thank you so much for allowing me to examine you. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now. Hi. I'm going to be performing your comprehensive physical examination today. How you doing today? I see. I hope by the time we are finished with this examination, you feel even just the littlest bit better. So I'd like to ask you just a couple of confirmation questions, if you don't mind. I could just have your name and date of birth. And is that your preferred name? And how do you like to be addressed? There we go. This comprehensive physical examination involves quite a few different tests, as the name would suggest. We are going to be looking, for example, at your scalp, at your eyes. We've got our Snellen chart back here that we will get into in a little bit. I have the ophthalmoscope, the otoscope. We've got some reflexes to check. We are going to have quite a few little fun things for you today. So, to begin our examination, I'd just like to ask permission if it's all right to touch you. Wonderful. Thank you. So we are going to start with the scalp. We are going to take a look at the head. We'll move on to the face, but I want to begin right in here. Would you mind telling me if you've had any issues as of late with your scalp? I know we're getting into the warm season, so sometimes our scalp chemistry changes a little, but anything out of the ordinary for you? Just looking at the hairline here. Yeah, let's look around the ear. No changes, that's good. That's good. And we'll come around to the other ear. Good. And I'm going to get a little closer here. And I'm actually just going to take a peek behind the ears, if you don't mind. Okay, so just going to take a little look here. So this is a common place for skin conditions and lesions to hide. Because we can't exactly see it ourselves, we're not going to be able to catch things very quickly if we don't have a way to see them. So that's where I come in here, and I'll take a little look here. Good. So the root of the ear and the back of the cartilage are all clear here, which is good. So let's move on, and we'll work more towards the posterior head. How's your week been going? Yes, it was absolutely gorgeous, and then all of a sudden it got quite warm, yeah? That's the thing about Iowa, the Midwest in general. If you're not happy with the weather, just wait. 4 seasons in a day. Good. There. Now, let's go ahead and just take a little look at your face. So, are there any issues, any conditions that you have any concerns with on the face? For example, you might be experiencing some skin sensitivity or persistent redness you might not have dealt with before. Maybe there's an itchy spot or a dry, flaky spot that doesn't seem to go away. Maybe there's a new freckle or mole. Anything like that? Just feeling the texture of the skin down the nose. No, okay. Good to know. Here we go. texture has been even throughout your skin. It's not reddening up where I touch it. It's not overreacting. Which is good. And I'm not seeing any spots that I would be concerned with either. It all looks gorgeous. Excellent. So I'm going to run through your lymph nodes real quick. We are going to start at the posterior head with the occipital nodes. Then we're going to bring that behind the ears to the postauricular area. In front of the ears to the preauricular nodes. We'll go down the neck. We have anterior cervical, deep cervical chain, and posterior cervical. And then we'll finish at supraclavicular above the clavicle. So let me have a little feel here. There we go. Now, despite the heat, it's been a little noisy today, hasn't it? I've noticed that. It's interesting how some days, the same activities, usual suspects, the sound just carries a little different. And you know what I forgot to mention? We, of course, need to get the submental and submandibular nodes underneath the jaw. That's a very important spot. It's also kind of an odd spot if you do have some distension in the nodes. It feels like you have a pea under the skin or like a little bead right on the jaw. Good. And then we'll come down the neck. But I've kind of enjoyed the noise a little bit, to be honest. It makes everything just sound fuller. There's people out enjoying their lives, and you're just kind of hanging out and being a part of it too. Then we'll come to supraclavicular. Good. So, no distension that I can find, which is good. You haven't been fighting off any sort of infection-like symptoms or any infections recently. Okay, very good. So let's go ahead and take a peek at your sinuses. So we are going to press and tap, tap, tap all along the frontal, ethmoid, and maxillary sinus cavities, so named for the bone area there around. So I'm going to press in, starting with the forehead. Let me know if there's any pain or tenderness, right? Wonderful. So we're going to press, release, press, release. Just like that. Good. How does that feel? Press, release. maxillary cavity. Very good. So now I am going to do some direct percussion, meaning that I am going to be directly tapping over the sinus cavity areas. Let me know if this is painful or tender. Just going to... Good. And the maxillary side. How was that? Good. So let's take a break for just a moment while I jot some notes down. Now, I would like to test a couple of the superficial muscles of mastication, which is kind of a long way of saying I'm going to assess the masseter and temporalis muscles right in here. So if I could just have you clench the jaw, unclench, clench, and unclench. Good. And up here, clench, unclench, clench, and unclench. Good. Was there any pain or tenderness with any of that? So we are going to test cranial nerve number 5. This is the trigeminal nerve, and the cranial nerve number 5 actually has sensory and motor functions. The motor was partially with the muscles of mastication, but now we're going to test the sensory aspect. So, in my buckhammer here, a little pointed tip here, and in the bottom we have a tricky little brush there. So I am just going to have you tell me whether you feel the softer brush or the sharp pointed tip. Just going to test these on your jaw real quick so you know what those feel like. This is the soft. Good. And this is the sharp. Just like that. Yeah, it's not going to break the skin at all. Doesn't hurt. Just feels like a pointed point of contact. If I could just have you close your eyes. No peeking. And tell me whether you feel the soft or the sharp touch. sharp, soft, sharp, sharp, soft, soft, sharp, soft, 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 sharp, sharp, soft. Very good. So I'm going to put these back, and then we are going to test another cranial nerve. That would be cranial nerve number 7, the facial nerve. Just pop this right back in. Go. Very handy. So to test cranial nerve number 7, I am going to have you make some expressions for me. So firstly, if you could just raise your eyebrows. Very good. And if you could squeeze your eyes tightly. Okay. I'm going to try to open your eyes. I want you to resist me. Keep your eyes nice and shut. Good. And you can open them. If you could widen the eyes. Excellent. If you could puff out the cheeks. Good. If you could smile real big, showing the teeth. And if you could frown for me. It's a little difficult to try to do on command. Yes. Okay, very good. So, we are going to be moving on to the eyes. I would like to have a little closer look at your eyes, if you don't mind. Okay, so let me take a look here at each. So we want to note that the eyelashes are intact, that the eyebrows are intact. Looking at tear ducts, and let's take a peek at the conjunctiva. I'm going to pull up on the eyelid. I'd like you to look down. Up, you look down, 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 down. Good, and I'm going to pull down on the eyelid. I'd like you to look up. Look up. Good, very good. All the tissues look healthy, sclera looks clear, the pupils are round. Let's take a closer look at those pupils. So, if you could just look at my nose here, I'd like to look at the pupillary response of the eye. So we want the pupils to be equal, round, and reactive to the light. Good. Just keep looking at my nose. Good. Just keep looking at my nose. Excellent. So, while I've got the light, I am going to perform the direct consensual response test. I'm going to put my hand right here between your eyes. Just going to bring the light here, and I'm looking for the pupil to react to the light. That's our direct, direct, direct response. Good. And when I shine the light in this eye, the other eye should react in the same way, even though the light's being blocked. That is our consensual response. Consensual. 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 Good. We'll switch. Direct. 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 Good. And consensual. 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 Very good. Let's put that away for the moment. I want to look at your eye movements. This is governed by cranial nerves 3, 4, and 6. So if I could just have you look up for me. Look up. Good. And if I could have you look down. Look down. Good. Look up. And look down. There you go. Look up. And look down. Good. And if you could look to the side here. Good. And to the other side. Look to this side. And the other side. Good. If you look up in the corner here. Good. And down here. And look up in the corner here. And look down here. Good. And back up here. Back down here. Back up here. And back down here. Good. And if you could follow this finger as it comes in and out. In and out. In and out. Switch to the side. Just follow my finger as it comes in and out. In and out. In and out. Wonderful. So let's take a peek at the Snellen chart back here. We're going to test your visual acuity, give you a break from all the looking around. I am going to have you read the letter that I point to with my indicator here. Just do the best that you can, and we'll start right up here with the very first letter. What is this letter right here? Good. How about right here? What's this letter? Right here? Good. Now in the 20/140 row, what do we have here? Here? Good. And here? Excellent. What about row number 4? Let's go backwards here. What is this letter? Here. Good. Here. Yep. And right here. And row 5. What is this letter? Here. Good. And here. And how about this one? And right here. over 50 row. Right here. Good. Here. Right here. Yep. Here. Good. Here. And here. Excellent. We'll readjust a little. What about this letter right here? Okay, and here. Right here. Good. And what about this one? Excellent. This one. Good. What about right here? Here. Okay, good. And in the 8th row here, right in here, let's go backwards. Right here. Good. Yep. Right here. Good. Here. Yep. Yep. Good. So now the 20 over 25 right in here. Can you read this one? Good. Good. Excellent. Yep. Wonderful. Brilliant. Gorgeous. Yes, very good. Now, we're going to do the 10th line here. If you could just read me this letter. Right here. Good, right here. Excellent. Right here. Good. Here. Yep. And just for funsies here, just for fun, can you read row 11? 20 over 10. Right here. Good. Yep. Good. Good. Yep. All right. Excellent. Now we're going to finish off the eyes with a test called the fundoscopy. Now this means that I will be looking with the ophthalmoscope here at the fundus, or the back of the eye. And I can do that just with this little scope and some light. So I am going to put my hand on top of your head, just so that I'm not going to run into you. And I'm going to come in at an angle, looking for the red light reflex here. And then I'm going to come in real close so that we can look at the back of the eye. So here's where I can see the optic disc. That's where the optic nerve will go back to the brain. And that gives your brain the information from your eyes. It's an afferent nerve. Good. I'm going to come back here. And we'll do that on the other side. We have the optic disc, and you can also look at the little blood vessels. Maybe pick out the macula as well. Good. Just looking on the health here of the fundus of the eye. Very good. So I am going to switch out the heads. And we are just going to bring the otoscope into play instead. Good, and then we're going to get a new speculum that just snaps on. Just like that. So, I would like to take a little look at your ears, if you don't mind. Okay? Just going to have a little overview of the ear. So, the cartilaginous part of the ear here, this is called the auricle or the pinna. And you have quite a few folds in there, right? And their function is to funnel the sound into the external auditory meatus here, or the ear canal. Good. And is any of this palpation uncomfortable? Good. So we've looked at the back of the ear, and the rest of the ear here looks good. Let's take a peek at the other one. So right in here we have the tragus. It's that little fleshy bit right in front of the ear. We have the lobe coming up to the helix, our big rounded part. Antihelix opposite of that. We have the concha, which is our bowl of the ear. And we have the antitragus, which is opposite of the tragus. And of course we have the ear canal, which I'll be taking a look at in just a second. Good. Let's take a peek inside the ear. So I'll be looking at what is technically the middle ear. The inner ear has, for example, your stapes, incus, and malleus, but your middle ear is your ear canal and your tympanic membrane. I'm going to take a little look. And here back. And let's have a little peek into the ear. This ear, we have the ear canal. I need to check for blockage, redness, irritation, scratches, things like that. The little hairs inside, and look at the cerumen that helps the ear clean itself. Also take a little look at the tympanic membrane here. Good. Is any of this painful at all? Very good. And have you been having any issues with the ears? Whether it's itching, a feeling of fullness, maybe any discharge, things of that nature. Okay, and how about your hearing? How's that been? Good. Okay, so let me take a look at the other ear. So on the side, we are going to be looking at all the little structures, little tissues in the ear. But while we focused on the
I should see a reflection of the otoscope's light.
Good. Now, I would just like to do a basic hearing test with you. I know you said your hearing was not affected, but I just want to make sure. So I'm going to be whispering some words in one ear or the other. I'd just like you to repeat what word you hear.
Basic.
Good.
Saline. Pencil.
Good.
Sandal. Paper. Rope. Scarf.
Good.
Curtain. Leaf. Chair. Table. Mirror. Shelf. Binder. Notebook. Marker. Filigree. Plastic. Light. Linen. Elastic.
Very good. So it seems that all of those came in loud and clear. Wonderful. So let me just... Good. Now we're going to move on to the nose, mouth, and throat. We'll also assess cranial nerve number 12. So if I could have you tip up your head for a moment, I'd like to take a look
Inside the nasal passages. Have you had any issue
with breathing through the nose or with your sense of smell. No? Good. That's good. Just taking a peek, looking at the tissues.
We want them to be pink and moist with the septum in midline.
And no perforation. And if I could have you open your mouth. Good. Let's take a look. My tongue depressor, and we'll take a look at the inside of the buccal mucosa, for example. We'll look at the teeth. Good. Inside the cheek there. There we go. Good. And the tongue, if you could lift that to the roof of your mouth. Good. Good. That looks clear. You can lay that back down. And now if you could stick out your tongue as far as you can and flatten it. Just going to come in with my depressor here. We're going to look at the back of the throat. So, we're also going to test the glossopharyngeal and the vagus cranial nerves. If I could have you just say, ah. Good. Let's take a look at the throat. The tissues look clear there. No issues with the tonsils. Do you have your tonsils intact? I see. Good. And if I could have you stick out your tongue for me, for the hypoglossal nerve, you could lift your tongue up and move it down, move it to the side, and the other side. Good. You can put your tongue back in your mouth, and if you could swallow. Just want to test the function of your throat there. And just try to take a dry swallow. I know it's a little difficult. Just yeah, trying to do that feels a little uncomfortable, huh? Yes. Okay, very good. So write that down, and then we're gonna take a look at the neck here. I'm gonna grab my stethoscope. We're going to start by auscultating for bruits, B-R-U-I-T-S, and this is an audible heart murmur. I'm going to put my stethoscope, the diaphragm here, on the carotid artery, and I'm going to have you take a deep breath in and hold it. That way I won't hear the sound of your breathing, but I'll be able to isolate any possible blood flow issues in the carotid. So if I could have you take a deep breath in and hold. Side, deep breath in, hold, and let it go. Good. So I'm just going to put this here for a moment, and I'm going to palpate the carotid. It's very light here. I want to assess the strength of the pulse. Good. Okay, let me take a little look at the neck, and we'll take a peek at the thyroid as well. So I'm going to palpate the trachea and make sure that is midline. Good. I'm going to have my fingers right here. If I could have you take another dry swallow. Just want to feel around the thyroid here. Yeah, take your time. I know it's hard to do multiple dry swallows. There we go. Okay, that looked all good. Now we are going to do a little bit of palpation and percussion on the chest before I bring this bad boy back out. So I am going to palpate, firstly, the apex beat of the heart. This is going to be the mid-clavicular line, right in the middle of the clavicle. If I match that with the fifth intercostal space, which are the spaces between your ribs, those muscles in there. If I go 1, 2, 4, 5, and match those two up. That's about where I should have the apex beat. I'm going to feel that for a moment. Good. Good. Okay. And then I am going to do a little bit of percussion. So this is an indirect method of percussion. I'm going to be putting my hand on your chest, and I'm going to be tapping on my fingers and listening for the sound that comes back out of your chest, whether it's resonant, hyperresonant, dullness, or has a stony dullness to it. So I'm going to put my hand on your chest and just tap away. Here to the other side. Good. Good. If I could have you lift your arms up. There we go. There, excellent. So now let's bring the stethoscope back in. And I'm going to listen to your heart first. You don't have to breathe in any special way. I'm going to start at the top here at the aortic area. We're going to go around the chest, in the pulmonary area, the tricuspid, and the mitral valve here. Excellent. Now for the lungs, I'm going to put the diaphragm in different positions on the chest, and I'll have you take a deep breath in and out. We can listen for crackling, wheezing, other sorts of abnormal noises. You take a deep breath in and out. 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 You could lift your arms again. Good. Deep breath in and out. Deep breath in and out. Here we go. Now I'm going to jump right into auscultating the abdomen. We want to do that first because it's almost like if you have a clear lake, right? As soon as you step in that water, it's going to mix everything up. It's not going to be like it was before. It's kind of how it is. If I start pressing down and tapping around, I'm not going to get the same sounds as I would have if I hadn't done that. So, I'm going to have you breathe normally here. And this is going to be much quicker in that I'm taking a couple seconds to listen, though we have quite a few different areas to cover. Put this away. And then I'm going to do some percussion here with the tapping on my hand. We're going to listen for the sounds that come back. Following the borders, you can hear we're over an organ. If an area has fluid, or if it's hollow. I'm going to do some palpation here. So if I could have you just breathe normally, and let me know if any of this is painful or tender. We'll start with one hand. And then I'm going to go in with two. I'm going to have you do your best to just breathe through this one. This one tends to be more uncomfortable. Good. So, we are going to move on to the upper and lower extremities. We will test your reflexes and do a little spinal examination, and last one's going to be gait and coordination. So, if I could see your hands, please. Good, just palms facing the floor. I'm going to take a little peek, and I'm going to test the temperature using the backs of my hands. I go hands up the arms. Make sure the joints are not super hot or that the skin's not clammy, cold even. Good. And you take a peek at the nails here. Oh, we're looking for the condition of the nails, if there are any nodules or maybe cholesterol deposits around the nails, staining, that sort of thing. Looking at the color. I'm going to press down on each of your nails. We're going to test the capillary refill, which tells me how your circulation is doing. It should blanch the skin, and then when I pull off the color should return in less than 2 seconds. There we go. So I am going to palpate each joint distally to proximally. Let me know if any of this is painful. Have you had any problems with your joints? Pain, swelling, heat? Very good. And is any of this painful or tender? No, very good. Now, if I could have you flip your hands over, I'm going to assess the pulse in your radial arteries for a moment. Good. It's nice and relaxed now. Been here for a bit. The room's quite cool compared to the outside. Some nice atmosphere. Good company too. Good. Now I'm going to look at the surface of the hand. Look at the palms, the thenar and hypothenar muscles. And look for example, palmar thickening, skin abnormalities. Good. Good. So let's do a little bit of range of movement testing. Probably going to get a lot of joint cracking and creaking. So if I could have you close your hands into a fist and open the hand. Good. You could make a tabletop with the hand and curl the fingers over the palm. Good. And can you move your wrists down? Up, down, up. Good. In and out. And if you could rotate them back and forth. Good. So if I could have you lift your arms up to the sides and all the way above your head, backs of the hands touching. Good. If you could bring them all the way forward as high as they can go and all the way back as far back as they can go. Good. Can you put your arms up like this so the elbow is at a 90-degree angle? Good. I'm going to try to push you. I want you to resist me. Good. And I'm going to try to pull you, and I want you to resist me. Very good. Now, if I could have you just hold your upper arms at your sides with your elbow making a 90-degree angle again, and move your elbows in and out. Okay, but at your sides. There we go. Very good. Okay. And can you shrug your shoulders for me? Just a few shrugs. Okay, so our cranial nerve number 11 looks good there. Let's take a little peek at the lower extremities. So we're going to look at the legs. Usually what we notice here upon inspection, the shins can get some goofiness happening. And we'll look at the feet, check the capillary refill. So temperature feels good. If you had any problems with any of the joints in the lower extremities? Nails look good. And I am just going to press down on each of the nails and look at the capillary refill. Good. And then I'm just going to feel our post-tib pulses here. Then we'll move to dorsalis pedis. Right there. Nice and strong. Good. Good. Okay. So let's go ahead and do a little range of movement here. So if I could have you lift the thighs up. Good. Can you rotate the legs at the hip? Might have to do it one at a time. Just get a little rotation and back. Good. Okay. Can you kick out the lower legs and bend at the knee? Good. And can you move the feet up and down? In and out. And roll them back and forth. There we go. Excellent. Let me bring out the reflex hammer. We'll work our way back up. So, as I said before, this is the buck hammer. That's what this kind is called. So, I'm going to take your foot here. I'm going to have you let this relax. I'm going to be tapping behind your ankle on the Achilles tendon here. Right? Just let the foot relax. There we go. Okay, let's try that again. There, that's better. Feels a little weird, doesn't it? Yes. Oh, and the other foot here. I'm going to hold it up a bit to get a little bit of tension on the tendon. And if I could have you just let everything go slack. Good. And there we go. Good. Now the knee jerk is pretty easy. Just have you relax the legs. Okay. Let them go floppy. There we go. And good. Get a few little kicks in there. Good. So now we'll move to the arms. I'm going to do the triceps and biceps reflexes. If I could have you just rest the arm over the thigh. Good. And let it just hang down. Let everything go loose. Good. And I'm going to tap along the back of the elbow here. Just keep the arm relaxed. There we go. Get a couple of misses in there, huh? Now the other side. Lay the arm across the thigh. Let everything go loose and floppy. There we go. And then, there we go. Perfect on each tap. Now for the biceps reflex, I'm going to put my thumb rather, in the crook of the elbow, and I'm going to tap on my thumb. I'm just going to hold your arm, wrap my fingers around the elbow, and tap. There we go. Good. The other side, wrapping my fingers around the elbow. Thumb in the crook of the elbow. Good. There we go. Now, we are going to do a little spinal examination, and for the gait and coordination, both of these I'm going to have you standing, okay? Alright, so if you could stand up and turn around for me, I'm going to have you bend down as far as you can. I'm going to have you very slowly come back up, okay? So bend down as far as you can, as far as comfortable. And I am going to have you very slowly, vertebra by vertebra, come back up. And I'm going to palpate along as you're doing this. Okay, good. And then to test your gait and coordination, I am going to have you walk to the end of the room, just normally. And then if I could have you come back walking on your toes. Good. And if you want to go back walking on your heels. And if you want to come back, this is called tandem walking, where you're going heel to toe, touching heel to toe with every step. Sometimes they try to have drunk people do this test. Good. Good. That looks good. Did that feel wobbly at all? Any of those different walks? Very good. So, go ahead and sit down. And I'm just going to write up your final notes. Do you have any questions for me? Okay, very good. I am confident that your health is in the most perfect state that we could achieve, and everything looks excellent. So, if you don't have any more questions, I'm going to sign off here. And that'll be it. I'd like to thank you so much for coming in for this comprehensive physical examination. I hope you have a whale of a day and a good rest of your night. Thank you. Hello there, and welcome. My name is Calliope, and I'm the nurse who's going to be performing your examination today. How you doing today? I see. I hope by the time you leave this examination, you feel even just the littlest bit better. Now, we are performing a head-to-toe assessment today, and to get started, I would like you to just confirm your name and date of birth for me. Wonderful. And is that your preferred name? How do you like to be addressed? Excellent. Now, to start with, I am going to do a short little neurological exam, but this assessment has many different parts. We're going to be looking at your cranial nerves. we're going to be looking at your eyes, your head, your heart and lungs, your extremities, essentially the entire package. Now, for our little neurological exam, I just have a few very simple questions. So if you could tell me, where are we right now? Where are we at? If you could be as specific as possible, down to the room perhaps. Wonderful. And what time was your appointment? Excellent. What is the date today? What is the date? Excellent. And what are we doing? What are we doing in this room? What is the purpose of us being here? Head to toe assessment. Wonderful. So you are oriented to time, place, person, and situation, which is very good. And then we're going to move to the head here. I've got several different little tests to do for this particular area. Firstly, I'm going to get up real close and personal. And from this point onwards, I will need to be touching you for the purposes of this exam. Is that okay with you? Do I have your permission to do that? Wonderful. So let's take a little peek. And I'm just going to get real close here. And we're going to take a look at the face and a little at the head as well. We want to note that everything is generally symmetrical, that we don't, for example, have any signs of a palsy or anything else out of the ordinary. And that our proportions are generally equal as well. That the head is of normal size and shape. There, and the hair, and the neck. Wonderful. So let's just jot that down. And then we are going to real quick test the facial cranial nerve number 7. So I'm going to have you do some expressions. First, if you could raise your eyebrows. Good. And close your eyes real tight. Very good. And can you smile real big? Good. Puff out your cheeks. Excellent. And if you could frown. This one's hard for me to do on command. Very good. All right. Now I'm going to come in with some of our palpation. So this is where I start getting a little touchy. I'm going to be coming a little bit closer to you for that. And we're just going to do a little bit of palpation all around here. I want to feel the contours of the skull as well as the hair here. Feel around the base. We're just doing a general look. We'll get a little more, again, touchy as the exam goes on. This is just our little beginning beginning introduction.
Let me just take a look behind the ear there. Let me move there out of the way. Move here out of the way here. Wonderful.
Good, and the hair itself, it's good texture to it, and I'm just going to test the strength a little. I'm going to wrap a strand around my fingers and give it a few pulls. Good, I'm just going to card my fingers a little bit through the hair and look for any signs of hair loss. We don't want to see, for example, more than 10 strands pulled as I'm gently working my hands through the hair. That would be indicative of some sort of hair loss, alopecia, something along those lines. Good. Okay. We are going to move to cranial nerve number 5. This is the trigeminal nerve. I'm going to get a little tool to test that. Hidden right in my Tromner hammer here, we have a little compartment with a brush and a little pointed tip. So this is going to be our soft end. This is going to be our sharp. Just going to test this along your jaw here. So we have soft and sharp. Just like that. Did that feel distinctive enough? Very good. So the trigeminal nerve has sensory and motor functions. We are going to test the sensory functions firstly. So if I could just have you tell me whether you feel the soft end or the sharp end, right? Wonderful. So we're going to start. Sharp. Soft, sharp, sharp, soft, soft, sharp, sharp, soft, 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 sharp, sharp, soft, soft, sharp, sharp, soft. Very good. Let me put this back in here for safekeeping. And try to keep all the bristles, the brush bristles together. There. Now, let me just see here. Very good. Now we are going to work with some of the muscles of your face as well as one of the joints here. So I am going to be palpating the temporalis to start. So I'm going to have you just clench and unclench your jaw as I'm palpating around this muscle. So get a little feel here. And then I'm just going to have you clench the jaw, unclench, clench, and unclench. Good. Now let's work with the masseter. I could have you clench, unclench, clench, and unclench. Good. Now for the temporomandibular joint, right in here, I'm going to have you open and close the jaw. So if you could open the jaw, close, open, close. Good. Now we're going to test against some resistance. I'm going to be pushing against your jaw here, and I would like you to open your jaw against my resistance. So if you could open the jaw here. Good. And now I'm going to have you keep it open, and I am going to try to close it, and I want you to resist me. So if you could just hold that position while I try to close your jaw. Okay, very good. So your jaw is nice and strong there. You can go ahead and close the jaw and relax. And we're going to check your sinuses and your lymph nodes. So I'm going to start with the lymph nodes. We're going to come to the back of the head, underneath the hair here. We start with the occipital nodes at the occiput generally. Work our way to the postauricular nodes behind the ears and the preauricular nodes in front of the ears and submental and submandibular underneath the jaw. That's what that sub prefix means, under. Then along the neck we have anterior cervical, posterior cervical, and deep cervical chain in here. Good. And then we have supraclavicular above the clavicle. We're going to feel right in here. Okay, and there doesn't seem to be any swelling in any of those. So for your sinuses, we're going to do some pressure as well as some direct percussion on the sinuses. So I'm going to press down on your forehead, your nose, and along the cheeks. Just let me know if it's painful or tender at all. We're going to press, 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 press. Good. How was all that? It's just fine. Now we're going to go in with the direct percussion, or the tapping with my fingertips. Just let me know if this feels painful or tender. All good? There. And how about that? Excellent. Let me just jot that down. And we are going to move to the eyes. So first I'm going to do a little inspection here. Like what we did before, just a little more detailed. So I want to look at the eyebrows, for example, that those are intact, the eyelashes. And I'm going to pull the eyelids up. I'd like you to look down so I can take a peek at the conjunctiva. Pull up, you look down. Good. And I'm going to pull down, and I'd like you to look up, please. Wonderful. So I'm going to pull down, you look up. Up, 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 up. Good. Good. Wonderful. So, let's see. We have the lacrimal glands look pink and moist, and the sclera is bright and whitish. Irises are clear. The pupils, as I'm looking at them right now, look to be normal. But we'll take a little closer peek at those in a smidge. Now I'd like to test your eye movement. We have cranial nerves 3, 4, and 6. For this one, we have ocular motor, the trochlear and abducens. So I am going to have you follow my finger here, using only your eyes without moving your head, so we can track how your eyes move. So I'm just going to come up, down, up, down. Good. Side to the side, side to the side. We're going to change it up just a little. Side, up, down, back to neutral. Side, up, down, back to neutral. And this is called the H test. Tests all your cardinal directions of gaze. We're looking for nystagmus, lid lag, any sort of abnormality in the way your eye tracks an object. We'll go diagonally up, diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down. Wonderful. Let's go ahead and look at those pupillary responses. We're going to bring out a pen light here. If I could have you just look at my nose. I'm going to bring the light in so that we can check the pupillary response. Ideally, the pupils will be equal, round, and reactive to the light. Let's keep looking right here. That would be our normal response. Very good. And let's just come back one more time. Good. Very good. We are going to test your optic nerve, cranial nerve number 2, and we're going to take it over to our Snellen chart for that. I am just going to have you read the letters on this chart to the best of your ability. We're going to start with line 1 right here. You could read this letter right here. Good. And line 2. You could read this letter. And right here. Good. Line 3. You could read this backwards. Right here. Good. 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 And what about this line right here? Right here. Good. Good. Yep. And line number 5. We could do this backwards. Good. Yep. Good. Good. And line 6 here. Right here. Good. Yep. Good. 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 And line 7. Yep. Good. Good. Yep. Good. And line 8. We could read this one backwards. Good. Yep. Good. Good. Yep. Good. And let's try to see what we can do for the lines below our second solid line here. So number 9, we could try to do this one. Good. Keep going. Yep. Line 10 as best as you can. Good. Good. Yep. Just for funsies, let's try to do line 11 here. Good. Good. These are pretty difficult. Good. Okay. So for our ears, and I say that meaning your ears, of course, we're going to do a little inspection and otoscopy with the otoscope here. I'm going to have a little peek at your ears and just take a little look with my light. We've looked behind the ears for any signs of lesion or abnormality. Here we're looking at the tissues of the ears and noting if there's anything that perhaps I need to investigate further. Of which, upon inspection, it doesn't look like it. So we are going to look inside the ears. I'm going to pull the ear up and back to straighten out the canal. I'm going to put the otoscope in your ear and take a little look. Up and back. And take a peek here inside the ear. So when looking in the ear, can look at the other ear here. And then we can test your hearing. So I am going to be just whispering in one ear or the other. If you could repeat back what you hear for me, right? Wonderful. Scarf. Good. Plaid. Mm-hmm. Mm-hmm. Sourdough. Mercury. Mm-hmm. Orange. Wrap. Mm-hmm. Chocolate. Good. Plentiful. Auxiliary. Cortex. Composite. Very good. And all of those sounded rather clear for you. It wasn't a struggle to hear them. Very good. So, cranial nerve, number 8. Here we go. Now we are going to take a look at the nose, mouth, and throat, and we have quite a few cranial nerves to look at in these areas as well. First, I'm going to start looking at your nose. I'm just going to take a look around. You don't have any difficulty with your sense of smell, taste, with your ability to breathe? No. Very good. Excellent. And I'm going to grab the otoscope and let me just pull off the speculum. Because that was just in your ear. That would not be polite. And I'm going to have you tip your head up so I can look inside of the nasal passages. And we can get a little bit of a view of the turbinates, but primarily I want to look at the septum and the passages themselves. So we're looking for perforation, swelling, discharge, irritation, things of that sort. But that looks good. I'm going to test your ability to breathe within each nostril. So I'm going to hold one side and just have you take a couple of breaths. So I'm going to hold this side. If you could just inhale, exhale, inhale, exhale. Good. Inhale, exhale, inhale, exhale. Wonderful. And was that difficult for either side to breathe through individually? No. Wonderful. Now I'm going to test cranial nerve number 1, our olfactory nerve. I'm going to test your ability to smell. I have a little container here. If I could have you just take a smell here. And if you could tell me what that smells like. Very good. That is isopropyl alcohol. Very easy. Now we're going to take a look at your mouth. We're going to do our inspection first, and then we have a few cranial nerves. If I could have you open your mouth, we're going to look inside. Little cavities here. Yeah, looking on the other side here. And the teeth here. Looking for any signs of cavities. And if you could just lift the tongue to the roof of the mouth for me real quick. Good. Good, and you can lay that back down. Now I'm going to have you extend your tongue out of your mouth as far as it'll go, and I'm going to flatten it down. Good. Now, for the glossopharyngeal and the vagus nerve, we're going to do a couple of tests. So if you could just say ah for me. There, so uvula looks good and we are midline. Just going to look at the throat real quick. Good. Throat wall looks good. Alright. And if I could have you take a dry swallow for me. Yeah, it's a little difficult to do it on command, but you could do your best. Take as long as you need. I know sometimes that's kind of hard to convince your throat to do that. Take a swallow. Good. Now for cranial nerve number 12, the hypoglossal nerve. I'd like you to stick out your tongue and move it to one side, the other, up, and down. Wonderful. And you can put that back in your mouth. Good. So I am going to focus on the throat. We're going to start with auscultating the carotid arteries for any signs of bruits. If there were to be a bruit, I don't want to be feeling around in there. Take my stethoscope here. Good. And I am going to have you take a breath in and hold it so that I don't hear the rush of air in your throat and I can focus on the blood flow. So if I could have you just take a deep breath in. And exhale. Good. breath in.
And exhale.
Good. We will be bringing this back shortly. Just needed to make sure to get the all clear. And I'm going to do some palpation here. We're going to palpate the carotid. I'm going to look at your trachea and thyroid. So let me just come to the carotid here. Got good strength there.
The other side.
Good.
And I could just feel the trachea here.
Make sure that's midline. Wonderful. And if I could have you take a swallow again, I'm going to feel around your thyroid. So just do your best. 2 dry swallows in a row is very difficult. So take your time. Good and good. There we go. So that all looks good. Then we'll look at cranial nerve number 11 a little bit more with some shoulder movement. I'll check your head range of movement as well. So if you could just do a couple of shrugs for me. Just like that. Good. And if I could have you turn your head to one side, the other, one side, the other. Go up and down, up and down. Good. Can you tilt your head to one side? And the other. One side and the other. Very good. Was there any pain or restriction in movement with any of that? No. Very good. So we are going to move to the upper extremities first, and then we'll come back to the chest. Firstly, I'm going to palpate a couple of pulses here. So I'm going to check the radial. And then I'm going to check both radial pulses at the same time. We're looking for what's called a radial delay. Just for a few moments, make sure they're essentially synchronized. And the ulnar pulse along the pinky side of the arm, and the brachial pulse in the crook of the elbow, the cubital fossa, depression in the elbow there. Very good.
We have all of our pulses.
Let's look at your fingers and your hands. So we'll check capillary refill, look at the joints as well, assess the temperature. So I'm going to start with the capillary refill. I'm going to press down on the nail and release, and see how fast the color returns to your fingers. They should blanch under my pressure and then flush back with color less than 2 seconds after. Good. let's look at the hands. If you could show me the backs of your hands, palms to the floor. There. Good. Doesn't look like there's any nodes or deposits. The nails themselves look healthy and clear. If I could have you flip your hands over. Look at the thenar muscles at the base of the thumb, the hypothenar on the opposite side. And skin looks good, color looks good, and both sides are warm and dry. I'm going to palpate each joint here. Let me know if it's painful or tender at all. Just going to squeeze on each side of the joint, working proximally or distally to proximally rather, from the second joint to the first. And then I'm going to squeeze the sides of your hands. You could let me know if that's painful or tender. No? All good? Okay. Let's do a little bit of range of movement and strength testing. So I'm going to have you splay your palms open. Close them. Make a fist. Good. And if you could roll your wrists around, get a lot of cracking going on, back and forth. Good. And if you could cock the wrists back. Good. And bring them forward. Some flexion and extension going on. Very good. And I'm going to have you show me your elbows real quick. Just want to look at the skin on the elbows. Sometimes we can see signs of plaques here. Okay, I'm going to have you hold your arms like this, and I'm going to try to push you forward. I want you to resist me. Good, and I'm going to try to pull you towards me. I want you to resist me. Very good. And can you extend and flex the elbows? Good. Can you roll the shoulders forward and back? Very good. Now I'm going to test a couple of reflexes. We're going to bring out the Tromner hammer again. We're going to test the biceps and triceps reflex. If I could have you lay your arm on your thigh and let it relax. Let it go limp. And I'm going to come behind your arm here, and we are going to just good. Get the triceps reflex. And the other arm, if you could lay it across your thigh. Let it go limp. Just let it relax. Good. For the biceps reflex, I'm going to hold your elbow and put my thumb in the crook of your elbow. I'm going to tap on my thumb. Just holding the elbow, just going to tap right there. The other arm, let it go loose. Very good. Very good. So, upper extremities. Now, one last thing. before we move on to the chest, I'm going to have you hold out your arms here and close your eyes and hold them for a moment. We're going to check for any drifting, any abnormal movements, and you look pretty steady. Good. Go ahead and put your arms down, and let's go ahead and take a little listen to the heart and lungs. We're going to start with the lungs, and I'm going to have you take a deep breath in and out. I'll tell you when I need you to breathe. Deep breath in and out. 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 And for your heart here, I'm going to start up top with our aortic area. Pulmonary area. Pulmonary valve. Tricuspid. Mitral. Very good. So I am going to have you recline back, and we're going to first look for any jugular venous pressure issues. So lie back and then just turn your head to the side for me. I'm going to come look. See how the pressure looks there. Good. And then I am going to auscultate the abdomen. And then we'll do some palpation. Just keep breathing normally here. Good. Listening around the organs. Good. Alright, you're not going to need that anymore. And we're going to do some palpation. So we're going to start with a firm pressure and then work with a deep pressure. So I'm just going to press in with one hand to start. Let me know if any of this is painful or tender at all. All good? Okay, I'm going to to go in with 2 hands for our deep pressure. Might be a little uncomfortable, and I'll just have you try to breathe through it. Good. Yeah, it almost feels like I'm trying to get to your spine from here. It's very deep. Any pain? More, I imagine it's a little tender, but out of the ordinary. Out of what you wouldn't expect. Good. Good. Okay. Just a moment. Wonderful. So, I'll have you come back up to sitting, and we are going to work with the lower extremities. So I'm going to get some pulses, and we'll check the capillary refill again. So first off, we have the popliteal pulse behind the knee in the popliteal fossa. And this one can be tricky. And sometimes you can't really feel it at all. There we go. Just need the right positioning. And we have post-tib and dorsalis pedis. Good. And those are essentially synchronized as well. So, capillary refill. We'll check each of the toes. Make sure the circulation is, well, circulating. And circulating correctly. Very good. And we're going to check some of the strength and range of movement as well. So I am going to have you lift your feet up, and I'm going to try to press it down. I want you to resist me. Good. And I'm going to have you keep your feet down. I'm going to try to press them up. I want you to resist me. Good. I'm going to try to press your shins forward. I want you to resist me. And I'm going to try to pull them towards me. I want you to resist me. Good. I'm going to press down on the tops of your knees. I want you to resist me from pressing them further down. Good. And I'm going to try to pull them up, and I want you to resist that. Legs are very powerful. This one usually doesn't end well for me trying to move you around. Now let's do a little range of movement. So if I could have you move the toes up and down. Good. And can you move the feet up and down? And inwards. Out. Good. And can you give them a few turns? Rotate them inwards and out. Okay, can you extend the leg at the knee? And put the legs down. Can you lift the legs up from your hips so that your thighs are coming off the table? Good, and put them down. Right, and can you move your legs out to one side at the hip? And the other leg. Okay, move them back. Good. And how was all that? Any pain or restriction? Very good. All right, so last thing, we're going to check your reflexes for your lower extremities. I have a Babinski hammer here, or rather I have a Taylor hammer so that we can check the Babinski reflex using the blade here of the hammer. So I am going to take your foot here and I'm going to stroke the sole of the foot with the blade. And we get the toes curling. Good. And stroke the sole. Toes curl. Very good. We'll bring back our Tromner hammer for the patellar reflex. I'm going to have you relax the leg, and then I'm just going to tap on the knee. Very good. Other side, relax the leg. Very good. Let me just good. And that looks like we are finished. Very quite pleased with your results. I don't see anything out of the ordinary at all. Did you have any questions at all? Okay, I'm going to sign off. And that will conclude our head-to-toe assessment. I'd like to thank you so much for coming to me for this assessment. I hope you have a whale of a day and a good rest of your night. Thank you. Hello there. My name is Dr. Calliope. I'd love to just get started if you don't mind. Excellent. So we are going to start with the stethoscope and the sphygmomanometer. I'm just going to pop this in. And if I could just see your right arm here. Okay, we are going to just put your arm into this cuff, this little sleeve here. Get that nice and tight. And I have a little dial here that has a convenient clip, and we are going to attach it to the cuff. Bit of a juggling act, this. Then I'm going to put the diaphragm of my stethoscope right in the crook of your elbow. Lastly, we have our little bulb that inflates the cuff. Let's just make sure this is closed. So if I give it a couple test bits there. Okay, that's open. And this is closed. Right. If I could have you just stay still, let your arm relax. Get this squared away. It's actually one of my least favorite parts about going to the doctor myself. So we're going to make it real quick. Okay. Let the air out of the cuff a bit. There we go. Let that go fully out. We'll just do it one more time. Okay? One more time. How you doing today? I hope by the time you leave my office you feel even just the littlest bit better. And a little bit out. And there's our diastolic. There we go. Let that go. Now, the juggling act continues. So let's take the dial off. And if you could just pull your arm out here. There we go. Now, just going to set that to the side. And then I can hear again. There we go. So let's just jot that down. So we had millimeters of mercury. And let's go ahead and grab your temperature. And while we're doing that, I'll grab your heart rate. So I'm going to have you give me your left wrist, and I'm going to have you also open your mouth, and we'll put this under your tongue, all right? Click that on. So just put that right there and lay your tongue on top of it. With the other hand, I'm just going to do our pulse here. Good. And there we go. Very good. Lickety split. So 4 degrees Fahrenheit with a nice even 72 beats per minute, and respirations are also within normal limits. So there we go. And I would like to just take a little feel real quick of your upper extremities, and we'll look at the capillary refill on your nails. So I'm going to put the backs of my hands just along your arms. Make sure nothing is too cold, too warm. The skin is dry. Okay, and then I'm just going to press and release on your fingertips. Press, release, press. Good. All right. So color is returning after less than 2 seconds. Excellent. Let's take a look at your face and your head. I'm just going to take a quick peek. Make sure the eyes are symmetrical, the nose, the mouth here, ears, the eyebrows, the cheeks here. Everything looks fairly symmetrical, fairly proportional. At least within normal limits, right? Go. Good. Let's go ahead and take a little look at your head. I'm going to do a bit of palpation here. Is any of this painful or tender at all? Okay. Let me know if it is. Good. And I'm just going to take a quick feel of your hair. And make sure that the hair is strong and that we're not losing a whole lot of it. Good. Okay, looks good. So I'm going to have you just look at my nose right here, and I'm going to kind of crowd around you, but it's for a purpose. So look at my nose here. Tell me when you see my fingers come into view. Okay, so Tell me when they come into view. Okay, which one's wiggling? Good, both. Tell me when they come into view. Good, which one's wiggling? Okay, tell me when it comes into view. Good, which one's wiggling? Last one. Tell me when my fingers come into view. Good, and which one's wiggling? None of them. Good. So, peripheral vision. Good. So, let's check for any drooping in the eye. Let's look at the sclerae. Look at the conjunctival tissues. So, you could just look straight at me here. Okay. The eyes. No signs of ptosis, and the sclerae are clear. Irises. Clear. Pupils. Equal. And round, we'll look at that a little bit more later. So, I'm going to have you look up at the ceiling. Go ahead and take a look, and I'm just going to look at the eyelids. Good. Good, okay. Go ahead and look right here. Good. Okay, look up at the ceiling. Good, okay, look back at me. Just jot that down. We are going to bring in the light. And I'm going to have you keep looking at my nose here. I'm going to bring in the light from the side, so we're going to bring it right here. Okay, and here. Good. And again, bring it to the side, at a diagonal. Okay, coming from behind you. There. There, good. Other side, so just keep looking straight ahead. Bring the light right there. Okay, and straight on. So far, pupils are equal, round, reactive to the light. Okay, right at the side, and then at a diagonal. There we go. Good. One last time. Now just at the side there. Diagonal. And keep looking right here. Good. So, corneal light reflex looks equal on both sides here. Just making sure. And your pupils are also reacting correctly. So I'm going to put my hand right in front of your eyes. We're going to look the direct consensual response here. Direct. Good. Consensual. All right. Consensual. Direct. There we go. Good. And direct. Direct. Consensual. Consensual. Good. Direct. Consensual. Consensual. And we are going to bring in a different object for you to focus on. I have this little white tipped tool here. I'll have you look at this, and then look at the light behind me. Good. Look at this. Look at one of the pink flowers behind me. Look right back here. Look at the green wall on this side. Right back here. And if you could look at the orange flower painting, the orchid, right back here. Good. Keep your eyes focused here. I'm going to bring it in real close, and we're going to try to get your eyes to cross. So we'll just come in. Okay, back out. In. Good. Back out. There we go. Very good. If I could have you just follow the tip as we go to the side, up, down. Just keep following this without moving your head at all. Good. We're going to test the cardinal directions of gaze. Do your best to follow it. If it goes a little bit out of view, okay, let's go up, down, up, down, good, side, side, there we go, okay, and how about diagonally up, diagonally down, diagonally down, good. Let's just do that one more time. There we go. And can you follow this in and out, in and out, in and out. Good. Other side right here. Follow this. And in, and out, and in, and out. Good. Put that down. I am going to have you look at the wall behind me on this side. I'm going to get my ophthalmoscope out. We're just going to take a little look at the eye. I'm going to put my hand right on your head so I don't run into you. So just keep looking at the wall. And I'm going to take a peek at the back of your eye with this. With this tool, we're able to see the optic disc, the blood vessels, the macula. Okay. Just keep looking at that wall. There we go. There. Okay. And if you could just look right into the light here. Good. Good. Okay. If you could look at the wall behind me on the other side. Good. And just going to come closer here. Keep looking at the wall behind me. There you go. Okay, so just looking at the optic nerve there and the blood vessel. Can you look right into the light here? Good. Good. Okay. Let's move on to your hearing. I am going to go behind you. We're going to do a little whisper test, right? Okay. I'll be right back. Okay. We just want to make sure that you can't tell which side that I am speaking on. So if you could just repeat the word red, yellow, green, orange, chartreuse, pink, brown, black. Good. 1, 2, 3, 5, 8, 13, 10, 9, 7, 5, 3, 1. Cow, chicken, aardvark, platypus, manatee, ox, groundhog, deer, coyote, wolf. I come back around. I'm just going to take a look at your ears before we bring in the otoscope. Do you have any difficulty with hearing any of those words when I was behind you? Okay. Was it fairly easy to distinguish right from left? Okay. Let's switch out the ophthalmoscope head for the otoscope. And we'll need a speculum. There we go, all locked in. And do you mind which ear I look at first? Okay, so I'm just going to come up right here, and we are going to kind of gently insert the otoscope. Take a little look inside the ear. Is this painful at all? Okay, good. Do let me know if it is. And look at the ear canal, the tympanic membrane. Make sure we can see all our landmarks. Okay, that all looks good. Everybody looks healthy and normal, so we're just going to go out, and then we'll take a peek at your other ear here. Look right here. Take a look around. Just do a little look around. Ear canal. Tympanic membrane. A couple landmarks. going to switch speculums. I need a different one because we're going to look at your nose. Let's see. Let's get one that's a little thinner here. There we go. We'll get that in a minute, so I'm just going to look at your nose here. If you had any issues with breathing, with runny nose, nosebleeds, dry nose, snoring, anything like that. Okay, good. So, you could just tip your head back. Look inside. Have you take a breath in and hold so I can have a good look. Just take a breath in. Hold. There we go. Good. Got the turbinates and the nasal passage. Okay, exhale. Breath in. And hold. Good. Alright. There we go. Looks good. Okay. All the tissues look good. Go ahead and breathe out. Now I'm going to occlude one of your nasal passages, and we're just going to have you take a couple breaths. Breath in and out. In, out. Good. Other side. Breath in, out. Breath in and out. Okay, good. So, did you feel like there was any trouble with any of that? Okay, good. Let's go ahead and do a little bit of percussion on the sinuses. Just let me know if you feel any pain or tenderness with this. It's about that season. Sinus infections abound, pressure, congestion, all the bits and bobs. Any pain or tenderness with any of this? Okay. Very good. We're going to get our light back out, and we're going to look at your mouth. We're going to look at your lips to start. Just make sure that the color's correct. Texture. If you could open your mouth, I just want to look at the corners here. Very good. And keep your mouth open. We're going to look at the buccal mucosa and the gums, the teeth. Okay. Very good. And if you could stick your tongue out. Good. We're just going to look at the pharynx wall there. If I could just have you say ah for me. Okay. Good. Alright, so I'm going to have you keep your tongue sticking out. And we're going to just check the tongue movement, make sure the hypoglossal nerve is intact. So if I could have you move your tongue this way, up, and down. Okay, very good. Put your tongue back in your mouth. take a peek at your lymph nodes. I am going to be just coming right back here. And we'll get the occipital nodes first. The post-auricular, preauricular, submental, submandibular, under the jaw, and anterior cervical, posterior cervical, deep cervical chain, and supraclavicular here. Okay, excellent. Now I'd like to make sure that your head movement is all right. So if I could just have you follow some instructions. If you could just turn your head to one side, the other, all the way up, all the way down. And can you tilt your head to one side, trying to touch your ear to your shoulder, and the other side. Good. Give your shoulders a couple shrugs for me. Okay, good. Bilateral, and that looks good. So, cranial nerve 11, the accessory nerve is intact. I'm gonna have to switch our side paper here. Not quite done, but running out of room on the front side. So let's go ahead and look at the trachea. So this might be a little uncomfortable. It's not very fun if someone is pressing in on your neck. So I'm going to look at the windpipe here. We're also going to look at your thyroid. So I'm just going to come in here and make sure the trachea is midline. And then if I could have you just take a dry swallow for me for the thyroid. Just like that. Okay. There we go. Good. Now we are going to be looking at your posterior chest wall or your back. So if I could just have you turn around, and we're going to do a few different tests here. Get out the stethoscope. Okay. There we go. Now I just want to check real quick on your back. I want to look at the spine. Okay, good. And if I could just have you bend forward. Right, sides look equal. And if you could very, very slowly come back up, vertebra by vertebra. Right. And I'm going to go ahead and check your chest expansion real quick while I'm here. I'll be putting my hands on your back. And as you take a breath in, my thumbs should pull apart. And as you exhale, come back together. So we want to make sure that maybe one side isn't going more than the other. We want to make sure that there is expansion and retraction. So I'm just going to put my hands right around your back. It's going to be a little tight. If I could have you take a deep breath in and out. Deep breath in and out. Good. So let's bring the stethoscope in. As I place the diaphragm on your back, I would like it if you would just say the word 99. 99. Good. 99. 99, 99, 99, 99, 99. Good. I'm going to listen on the sides here. 99, 99, 99. Now we're going to do another resonance test. So that was the vocal resonance. Now we are going to do some percussion. So I'm going to be tapping along your back. In both instances, we're listening for how the travels in your chest, whether it is resonant, hyperresonant, dull, or has a stony dullness. Good. Naturally, the sound generally gets lower the lower we go. Good. On the side here. Okay. Let's go ahead and do our auscultation. This is where I have you breathe in, breathe out. If I could have you take a deep breath in and out. Breathe 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 in and out. Last one on this side. Breathe in and out. And then the other side here. Breathe in and out. Breathe in and out. There we go. So while you're here with your back to me, I'm just going to check for any sacral edema real quick. Feel if there's any swelling here. Good. All right. So if I could have you turn back around, we will repeat a lot of that on the anterior chest wall. Okay. So we're going to start with vocal resonance. If I could have you say 99, 99, 99, 99, 99. Some percussion. There we go. Now, go ahead and listen to the lungs from the front. Deep breath in.
and out. Deep breath in. Deep breath in. Last row, deep breath in and out. Deep breath in and out. Okay. So, real quick, we're going to do some palpation around the heart. So, what I'm going to be feeling for with the flats of my fingers and the heel of my hand are heaves and thrills. These are palpable heart murmurs. Heel of my hand here. And then we'll take a listen to the heart. Start at the aortic valve. Just breathe normally here. Pulmonary, tricuspid, mitral. Good. And for the apex beat, so I'm just going to come here at the mid-clavicular line, and then along the sternum we have 5th intercostal space, right about there. Okay, good. That's where the apex beat should be, and that's where it is. I am going to be doing a little work with the neck here. We're going to take a listen to the carotid artery and doing some palpation. So, might be a little uncomfortable. Again, this one's much quicker than the trachea. So, just take a deep breath in and hold. Okay, exhale. Deep breath in. Hold. Exhale. Want to make sure there weren't any bruits or audible heart murmurs before I try to palpate the artery. So I'm just going to take 2 fingers, place them lightly here, and breathe normally here. Good, another side. Excellent. So let's go ahead and take a listen to your abdomen, and then we won't need the stethoscope for the rest of the exam. Breathe normally here. I'm just going to move around fairly quickly, a lot quicker than doing the lungs. Good. We'll do some percussion, map out the organs, some palpation. Good. Very good. Let's go ahead and just put this down. Our percussion here. We are mapping out our organs, making sure everything sounds correct. Now, I'm going to take a little feel around here. Let me know if any of this is painful or tender. Okay. Good. Now, this is going to be a little uncomfortable here, but we're going to be mapping out the liver and the spleen and the kidneys, see if they're palpable. So first, I'm going to have you turn your head to the side, and I'm going to push on your liver. So that's going to be right here. And as I do that, I'm going to watch what's called the jugular venous pressure. So, is this painful as I'm pressing in here? Okay, I'm going to press quite firm. So we'll go in. I'm just going to watch the neck here. And release. Okay. Alright, you can go ahead and just put your head back. I'm going to have you take a deep breath in. And out. Let's feel around the liver here. Okay. And deep breath in. And out. Then we have the spleen. Okay. Last one, kidneys here. See if these are palpable. And deep breath in. And out. There we go. Don't want to punch the air out of you. And make sure there isn't any air in here. Okay. There we go. Just going to take some notes real quick. Make sure that's all. Now I am going to look at your upper and lower extremities. So first I'm just going to press on the joints. Let me know if there's any pain or tenderness. So we have the shoulders here, the elbows, the wrists, and I'm just going to squeeze the hands as well as each joint. Any of this painful or tender? I wouldn't suspect so. Your joints weren't any warmer than the rest of you. And there hasn't been any stiffness. Good. Oh, that looks good. So I'm just going to take a little look at the skin. Make sure that's all clear. Good. Now I'm going to have you follow a few instructions for me. We're going to check your range of movement, a little bit of your strength. If I can have you close your fists, display your fingers open, make a tabletop, fold over the tops of your fingers and the whole fingers. Good. Can you bring your wrists in, out, up, down, roll them inwards and out. Good. And can you put your upper arms at your side and bring your lower arms in and out? So we have internal rotation, external rotation at the elbows. Okay, good. And can you bring your arms all the way up? All the way back. Have them start at your sides and come up at the side. I'm going to have you bring up your arms like this. I'm going to push on your arms. I want you to resist me. Okay. I'm going to try to pull you towards me. I want you to resist me. Good. Now I'm going to try to push down on your shoulders, and I want you to resist me. Press up into my hands. Good. Okay. Let's go ahead and look at your lower extremities. So, we have the hips, the knees, we have the ankles, and I'm going to squeeze the feet and the little joints in the toes. How's all that? Okay. Let's take a look at the skin, look for any abnormalities. Nothing is clammy. It's warm and dry. Okay, so I'm going to have you bring your toes up and down. Good. And your feet up and down. Okay, side to side. Good. Roll them in and out. Good. Kick out your legs at the knee. Okay. And if you could just take one leg and rotate it out at the hip, bring it back, rotate the other, bring it back. Good. Now I'm going to press your feet down. I want you to press up against me. Okay, I'm going to try to pull them up. I want you to press down. Okay, I'm going to try to press your shins forward. I want you to kick out. And I'm going to try to pull your calves towards me. And if you could just resist that. Good. I'm going to put my hands on top of your thighs. I'm going to press down, you press up. Okay, good. We have some good strength there. Lastly, let's get the Degerine hammer here, and we'll test some reflexes. If I could have you put your foot on top of my knee here, I'm going to hold the top of your foot, your toes, get a little bit of tension on the Achilles tendon. Then we are going to... Good. Other foot on my knee. Okay. Excellent. You can put your feet down and let your lower legs hang freely. Okay. Then we'll get the knee. Good. Now for the arms. Now you take your arm. Put your forearm on your thigh so that your hand hangs loosely between your legs. We're going to get the triceps and biceps reflex. Triceps back here, biceps right in here. I can have you just relax the arm, let it go loose and limp. Okay, I'm going to put my thumb in the crook of your elbow here. Okay, and switch to the other arm. Other arm hangs loosely between your legs. Forearm rests on top of your thigh. Triceps. Biceps. Good. So, deep tendon reflexes +2 across the board. And that is going to be the end of our examination. Do you have any questions for me at all? Okay, let me just turn this over. Let's make out everything. I'd like to thank you so much for coming in today for this examination. I hope you have a whale of a day and a good rest of your night. Thank you.